Welcome everyone. Thank you for joining us today. I'm Teresa Marentet, CEO and Chief Nursing Officer of the Windsor-Essex County Health Unit. Please continue to do your part to prevent the spread of COVID-19. Stay home if you are sick, maintain a 2-meter distance from others, wash your hands often with soap and water or use an alcohol-based hand sanitizer, use proper respiratory etiquette by coughing into a sleeve or a tissue, and wear a mask when you cannot maintain a 2 meters distance from others. I will now report our current case counts. There are 133,748 confirmed cases of COVID-19 in Canada and 43,536 cases in Ontario. Chatham-Kent has 364 cases and Sarnia-Lambton has reported 341 cases. Michigan now has 107,812 cases, with 13,875 cases being in Detroit. Today, we are reporting 2,561 cases of COVID-19, an increase of 5 new cases from yesterday. 3 are community-acquired and 2 are close contacts of confirmed cases. Overall, 26% of our cases are between the ages of 20 and 29 years, and 23% are between the ages of 30 and 39. 65% are male and 35% are female. 2,407 people are now resolved and 79 people are active and being followed by our health unit. 7 people are in the hospital. Our community has lost 75 people to COVID. 53 deaths have occurred among residents in long-term care and retirement homes. There are 2 retirement homes currently experiencing a COVID-19 outbreak. As well, there is 1 outbreak in the manufacturing sector. Symptoms of COVID-19 can range from mild to severe. Some common symptoms include fever, a new or worsening cough, a barking cough, chills, sore throat, and shortness of breath. There are several options to access assessment and testing centers in Windsor-Essex County. Erie Shores Healthcare in Leamington, Windsor Regional Hospital Olette Campus, and the Sportsplex at St. Clair College. And SOHAC in Windsor, where testing is available for First Nations, Métis, and Inuit people and their families. If you have symptoms and have been tested, you must remain isolated pending your test results. To check your results, please go to wechu.org and click View Your Results to access the online test result portal. If you're unable to view your results, please contact the assessment center or healthcare provider that initiated your test. The health unit will call you if you have tested positive for COVID-19. Please continue to visit our website at wechu.org for the most current information and case counts. I will now turn it over to Dr. Wajid Ahmed, our Medical Officer of Health.
Good morning, and thank you for joining us again. As promised, we'll talk about the community cluster that we presented last week. Just a quick background on how we identify these clusters. It is through contact investigation, which is a systematic process to identify individuals or contacts that are exposed to a confirmed case of COVID-19. As part of the investigation, what we do is we assess all these contacts for any possible infection with COVID-19 and then provide advice appropriately. Anyone who is identified as a close contact or as a confirmed case, the goal is to isolate those individuals immediately to prevent any further transmission. And then based on their symptoms, based on their status, we provide appropriate treatment testing guidelines for all the contacts with COVID-19. When we start to build all those contact investigation, and again, if it starts to go beyond one family and it involves multiple events, an automatic process, we start to put all these information together and put it in a form of a tree to see how each of these clusters are spreading or connecting with other individuals in the community. Based on the more recent information that we have, this is what the contact tree or the community cluster look like. It looks much more busy and much more complicated than the last time what we presented. But the idea behind linking all these cases is to make sure that we are not missing any of these individuals. If they have symptoms, if they have a COVID diagnosis, we can act immediately. We can identify everyone else who is at risk and provide appropriate recommendations such as isolation and or testing if they are symptomatic. What started off as an innocent party at one home, and because the social gathering limit was not maintained, and then these individuals went to another places, and then from there some group of people who went to another place and then had another gathering, which resulted in the propagation of this cluster up to a maximum of 37 cases that we have reported so far. So when we are looking at it, as of yesterday, there are 37 active cases, and all those active cases that we are calling it that only confirmed cases with this new cluster. There's a typo in the slide, as if you can see, it says to date 0 cases have been discharged. It's not true. It's 12 cases that have been discharged, and it is showed in the table below as well. So far, we haven't seen any death associated with this cluster. The earliest symptom onset date for specimen collection date is August 20th. What we have seen is out of these 37, 25 people are still getting follow-up and monitoring from our health unit. The ratio between male and female is pretty much similar. The youngest age what we have seen is 14 years, and the oldest person that we have seen is 77 years in this group. What is of concerning is the age group between 10 and 19, where we have 25 cases from that group, roughly constituting 70% or 68% of our cases in this cluster. And recognizing that the schools are starting next week, it is very important for anyone in that age group who are part of any of these cluster or events. If they are not identified yet, it is important that they connect with the health unit to make sure that none of them develop any symptoms while at school and potentially put other kids at risk. The overall, from a municipality perspective, based on the information that we have, this cluster majority of these cases are from City of Windsor, which is constitute 81% of all the cases in the from this cluster. Looking at the epidemic curve for this particular cluster, this is what it looks like. We have seen most of the activities between August 24th and August 26th, where we have seen a huge spike in the number of cases. But even the last case was reported to us as far as like September 3rd of this year, which again mean that there may be other individuals who either might be incubating the virus at this time or may have not been identified by this time. So if you are part of that if you're part of that event or this cluster, if you haven't been contacted, if you're concerned, please take appropriate precaution and contact the health unit. When we're investigating these clusters, some of the key information that we want to make sure that everyone is aware of, it's about the stigmatization and discrimination. We recognize that these events, when it happens, it tends to lead to people getting upset, stigmatizing and showing some discrimination about some of the individuals who are involved in those parties. That's not the intention, and that is not the public health goal or public health message that we want to share. Obviously, there is certain level of responsibility that we expect from every community member, but as part of the reducing that stigma, it's no one's fault. I think it's everyone's fault when you are part of that group and when you are engaged in these type of activities and not following the public health guidelines. So it is important that we continue to follow those measures, and then even if that event happen, how we can engage all the individuals who are part of that cluster, because it is important from a community perspective that we get in touch with everyone who was part of that cluster, everyone who attended some of those high risk events, and we need that, and we want to make sure that people are coming forward and people are identified so that we can put specific control measures in place. Other pieces that happens in this type of cluster investigation is the misinformation and rumor that starts to go on, and then it tend to identify people, it tend to go stigmatize people, discriminate against certain group of people. So that's something that we definitely don't want, and in order to do that, we want to present credible information that everyone can follow, up to the limit where we can share the information without putting anyone's privacy at risk. All those misinformation that's out there, we try to cover that in these type of cluster investigation. So in summary, what we have been saying that high-risk contacts are at a risk of developing COVID and must isolate for 14 days to prevent any transmission. So anyone who was part of that event, and they are all deemed as high-risk contacts because of the close proximity and the type of event that these individuals participated. So they are at the risk of developing COVID-19, and if they are not already doing it, they must self-isolate for 14 days to prevent any further transmission. And as of moving forward, the critical piece is reduce the number of close contacts to reduce the risk of contracting COVID-19. And I think, again, it goes back to our own responsibility as individuals, that the more social circles we have, the large number of people that we meet, there is a chance, there is a risk of contracting COVID-19, and we should be very careful when we are attending any of these events. Private parties and social gathering, even though as benign as it sounds, that you know the people that you are meeting, and even if there's one person that you don't know or you don't necessarily are aware of their activities or who else they're in contact with, it can easily lead to a large outbreak like this, which started off as a single party event, but now going all the way up to 37 cases in the region. And with large number of individuals, specifically for this cluster, under the age of 19, and we need to be extra vigilant on such events to keep our children safe and to keep our communities safe. Thank you.
The conference is now unmuted.
We'll now take questions from the media. We'll start with the Windsor Star.
Good morning, Dr. Ahmed. Just curious, the persons A, B, C, etc. listed on the chart that we're seeing here, are some of them members of the 6 families and some are not members of the families who just attended these events?
That is correct, yes.
Okay, so this has traveled far beyond just a few families.
That is correct, yes.
Okay, and it looks like we had 31 cases in the cluster last week, and now we've got 37. How do you feel seeing this kind of event? I mean, it's really impressive that the epidemiologists were able to trace it, but I guess it's disheartening to see that it happened.
Yeah, and I think that's what the message is, and again, we can all speak from our experiences as well, that there are some of these events happening everywhere. And it's unfortunate that this particular event led to the spread of the disease, but the key message is there's a reason that why there are some restrictions, why some of these public health measures are in place, and to see that spread in such a way, it's a clear indication of why we are recommending some of these measures that we recommend. And when we are talking about these gathering, whether we're talking about indoor gathering, whether we are talking about outdoor gathering, why it is important to still follow all those public health measures. And unless someone who's part of your social circle of 10 or social bubble of 10, anyone outside of that bubble, you should always follow all the precautions that we are asking you to do. We recognize that, we get it. It's been 6 months or more that people are following all those public health measures. There is a level of, people are getting tired of following all those recommendations. So we get that part, and we want them to take advantage of some of these loosening of the restrictions. But we also want them to be responsible. We also want them to continue to take all those measures and still keep it safe for everyone else around them and for themselves. So I think we hope that this particular example would serve some reminders to people and give them something concrete to think about, that how it can escalate into such a big cluster, and hoping that people will follow, and we can prevent this type of clusters from happening in the future.
Thank you.
Any questions from Windsor?
Good morning, Dr. Ahmed. The 3 cases today that were mentioned as community acquired, were those in any way related to the community cluster?
I can't say that. I don't think so. This all this data that we pulled, it was up until 2:30 yesterday afternoon, and I'm not sure that the 3 are linked to it. But as Teresa mentioned, these are still under investigation, and if something changes, we'll definitely let everyone know, but I don't think that these are linked with this cluster.
Okay. Okay, and have there been any cases that have resulted from community transmission, I guess, from this cluster? You had mentioned before that it was a low risk involved, but has anything resulted outside of like the close contacts of these members of the cluster?
No, I think I just want to be clear. So many of these events that happen, those are high risk events because in those events, there were many people and there were indoor events, and the likelihood of individuals coming in close proximity to each other was high. So those were high risk events. So anyone who participated in those clusters, I think that's where it started. And what Taylor asked is, it's not just the family members that ended up in spreading it to other people, but then when these families hosted some events, there are a number of people who participated in those events. And then if one of those individuals who participated in that event subsequently later on developed a case, and then they attended some other event, then it just further propagates that. So I think it happened through that way, that there is a mechanism, there is a tracing that happened, that how these individuals acquired the infection and then spread it to potentially other places.
Okay, thank you.
Any questions from CBC?
Yes, good morning, Dr. Ahmed. I'm just wondering, is the health unit working with the Southwest Detention Center on COVID-19 protocols for inmates there?
We do. We always work with many of the community partners, and we have had a number of conversations with the detention centers and other facilities. It's part of our work that we do in public health.
We've heard that when inmates are first brought into the facility, they're being quarantined for 14 days as a precaution, but we're hearing that there may be potential that those inmates who are quarantining are being exposed to new inmates as they come in who also need to quarantine. Do you know anything about that?
No, their protocol is very specific, and anyone who's coming into that detention center, they need to isolate independently, like separately, without anyone else for 14 days. They have strict protocol, they have strict guidance, they have rooms that are designed to keep these individuals. They have protocols in place to ensure that anyone who's coming in contact with these new inmates who are coming to the facility, what kind of personal protective equipment they need, what kind of interaction they need, what kind of distance that they need to maintain. So all of those things are in place. That's why I think we haven't seen any of these cases. Again, I'll just say with that caution that I think we have all those protocols in place. And so far, it looks like these protocols are working, and individuals are completing their quarantine before they're mixed with the general population.
Thank you, Dr. Ahmed.
Any questions from AMA 100?
Dr. Ahmed, with the cluster, I asked this question last week, I'll ask it again. Family A, is the health unit issuing any orders or fines against Family A because of what they caused for Windsor-Essex?
Well, I think it would be hard to say that they caused something intentionally. I think what I would say is anyone knowingly, if they have a disease and if they have done something which is against the advice of the health professional, I think that's where we would be issuing any violation notices, but not to say that we haven't done anything with with this cluster. We have had a number of conversations with all these groups, and they have received clear message from the health unit what the expectation is and what we want them to do.
Just to clarify, so Family A, were they aware that they had symptoms when they had people over, or they didn't know that they could be infectious?
It's hard to say, Rob. So what I can say is, when people are having mild symptoms, and if they still go on to these events without noticing that they may have COVID, because many people think that they don't have anything, and if they go into that event without taking precaution, then they are putting others at risk, and that's why it is important that you monitor your symptoms. You know, if you develop any symptoms, and Teresa go through the list of all the symptoms every day. If you think that you're exposed to someone who and puts you at a risk of developing or contracting COVID, if you're exhibiting any of these symptoms, then you should go and get tested. And until you get the test results back, especially if you have symptoms, you should not go outside and you should not socialize with other people. So I think that's the message. And I cannot divulge more specific details about the case, but that's the criteria that we typically use. That, and we recognize that many people may ignore some of those symptoms. It's not the time to ignore the symptoms, especially if you're thinking about that, by ignoring my symptoms and now I'm getting in touch with, let's say, 25 people or 50 people in a setting, then I'm putting everyone at risk. So I think that's where the responsibility piece comes in, and we want people to be aware of it, that it is your responsibility. You need to be careful of your actions, and especially in these type of large gatherings, you should always be mindful what you have and what you don't. And if you are exhibiting any symptoms, please do not attend those events.
The reason I asked about the violations, if violations would be issued, and I think my colleagues, we have all talked to businesses that have been on the exposure points list, and these businesses are they're impacted by being on the exposure points. So that's why I asked with the violation against family number one, because these businesses are feeling the effect. Even though I know you never place the blame on the businesses, like you said last week, they're doing their job, but at the end of the day, they're an exposure point. That's why I was just asking if this family would face a violation, because a lot of businesses in our community are suffering because of family A.
Yeah, it's unfortunate, Rob, that this is happening, but just like you remembered what I said, it's not the fault of the businesses. I think, and again, when we are providing out these messages, it's not to blame any business. It's more about the potential exposure location where others could have come in contact with. And as for the community as well, I want to reinforce the message that that there are certain levels of risks attached to everything that you are doing. There's no one business that is better or worse than the other. I think they all have good protocols in place. There's always some gaps. There's always an area for improvement in any of these businesses. But from what I can tell you, that if there's any businesses that are not following appropriate guidance from the health unit, those businesses are issued specific violations to keep the community safe, to keeping the individual safe. But at this time, the businesses are doing what they should do, and it's unfortunate that they are facing the impact of it. To answer your initial question about taking specific actions against any family, it has not been contemplated at this time, right now, we are looking forward to get everyone back on track and ensure that there are no other cases in the community as a result of this cluster.
Okay, thank you.
Any questions from Blackburn?
Hi, switching gears a little bit. Although we haven't seen a case in the agriculture sector now for over a week, is testing still being done on those farms?
So when we're talking about testing, obviously I always try to make the differentiation between symptomatic testing versus asymptomatic testing or surveillance testing. The asymptomatic surveillance testing is available for every resident in Ontario, that they can go to the assessment center and get tested. Similarly, for all these farms, they have the option to connect with the teams to arrange for mass asymptomatic surveillance testing. The rest of the surveillance activity, the screening activity within the farm, these are happening as we always do. And anyone who is identified as having symptoms, they are tested, and then it triggers the investigation to ensure that everyone is safe in that group. Many of the businesses, as we have seen, or so many of the farms that we have seen, especially the large ones, they have gone through the testing. They have had a significant number of cases, and many of those cases are resolved now. Some of these smaller farms, they are very well contained, and they're doing their best to keep their workers safe. So far, we are not following any of these cases at this time in agriculture farm sectors, but any farm who is going through the asymptomatic surveillance testing, the health unit may not necessarily be aware of those testing, but those options are available for them, all these farms, if they want to go through any of these surveillance testing. That is currently being arranged and monitored by Ontario Health Group.
You may already just answered this because you said you're not necessarily aware that all of them are happening, but do you know how many farms have gone through that testing?
I want to say at least 1/3 of the farms have gone through the testing. So if we have like 170-ish farm, we should have like 50 or 60 farms, at least to my knowledge, have gone through the testing. But again, we have to go back and talk about it. Like, why are we thinking that if we have tested, let's say 180 farms, then that's the only way we can be confident that this sector is safe? Because today we finished the testing in one farm. Tomorrow there can be a case, and it can just all go south and result in a number of cases. So I think my focus is not to put a number or to the target that I need to test all of these farms. My focus is to make sure that, do these farms have all the right things in place? Are they doing the good surveillance, and are they doing everything that they need to prevent any transmission in their bunkhouses or within their farms? So that's where my concern is, and that's where I think we should be concerned about, rather than thinking about whether that we want to get all of these tested. It's nice to have all those testing done, and if we can get that done, then maybe we can check one box off that we have tested, but that doesn't necessarily guarantee that nothing will happen in the future. And my concern is more from a prevention perspective, that what are the efforts that is needed to prevent any cases from occurring in these farms? And let's say if it occurs, what are some of the steps that we need to do to prevent it from transmission or getting other people infected as a result of that case? So hoping that as a system, we have all those things in place with the options and with the timely identification of all these cases, and I think that's where our focus is, and we hope that, knock on wood, so far we don't have any, at this time, there is no case in these farm workers, and hoping that it continues that way.
Thank you.
Any further questions from the Windsor Star?
Yes, Doctor. This is sort of going off what Owen asked you. I'm just wondering, did the health unit identify any cases confirmed as a result of any of the business exposures that stemmed from the cluster?
Not at this time. So basically what you're asking is if there's any transmission happen in these businesses. If that's the question, then no, we haven't identified any transmission happening at that businesses. Right now, it's just someone who was in their period of infectiousness. They visited that facility, and so far, to our knowledge, there is no transmission that we have linked that it happened in any of these business establishments.
Thank you.
Any further questions from Windsor?
No, thanks.
CBC?
No, thank you.
AMA 100?
No, thanks.
Blackburn?
No, thank you.
Thank you, everyone.
Thank you.